based in Houston, Texas. And I'm very honored in my job to have the ability to help families plan when and how they're going to grow. And that's really the crux of what I do day to day. And what's really important to me about these families is that they're making decisions on their own terms. Consulting with faith leaders, loved ones, their other physicians in their care team, that's all very important. But at the end of the day, the decisions we discuss on how to move things forward with their treatment are their decisions and no one else's. That discussion around treatment options is already a long one. It's full of important details. But in the past few years, thanks largely to things that Ted Cruz and others have pushed for, one extra question comes up very commonly, one that I'm asked a couple times every week, and it still hurts me to have to answer. Is it even safe to be pregnant in Texas? And that, again, is something that people ask every single week. We really just can't afford to have women in Texas asking that question, and we can't afford that room for politicians in the discussion when they do ask that. There's no room for Ted Cruz in this discussion. Right now, patients across Texas are suffering with that kind of anxiety. I've been pregnant myself in this state in the past few years and have felt that anxiety, that fear myself. Believe me and believe Texas women when we say that it is real. There is a fear of pregnancy in this state because of what Ted Cruz and other politicians are trying to do. We are less than 30 days now from Election Day, and in this year's Senate race, the contrast when it comes to reproductive care is so, so clear. Colin Allred wants to restore the standard we had under Roe v. Wade, and Ted Cruz, as he has made so clear, is only focused on him, his views, his agenda. That's why now the Texas Tribune reported yesterday, he doesn't even talk about abortion anymore, even though it's been a highlight of the things he's been doing in his career, things he's pushed for. He's keeping quiet on that topic now for political reasons only. His stance has been very clear. He got the judges and justices confirmed that overturned Roe. When Roe fell, he publicly celebrated it. And what did those justices just do yesterday? They let the Texas abortion ban stand in its current form. No exception for rape, for incest, for health of the mother, just like Ted Cruz wanted. And again, women are coming in asking, if my health is at stake, if I might die, will physicians in Texas be able to help me? These are real conversations that we're having frequently. So what changes moving forward, given the Supreme Court's decision? Nothing. The confusion continues, the chaos continues, the anxiety continues. The lives of women in Texas will continue to be at risk, and that involves not just their health, but also all of those that love them. Every family is at risk under this current state, and they will continue to lack access to the emergency care that they need. Many women will have to flee the state for their own health, for the own health of their family, and that's exactly what Ted Cruz has wanted for women in Texas. We do have the chance, however, to go in a different direction. We can elect a senator who will vote to restore the 50-year standard under Roe, who will stand up for reproductive freedom for us, for women, for physicians in Texas in a way that Ted Cruz has not done, would never do. He got us into this abortion ban, and I really hope this coming election day, Texas women will get him out. Thank you so much.
Hi, my name is Christina Probst. I'm a board certified general pediatrician and mother of two here in Houston. I actually came to Texas, to the Texas Medical Center, to do my training 26 years ago, and I've been in practice here in Houston for the past 23 years. One thing I can tell you is that across backgrounds, religious, political affiliations, Texas pediatricians and Texas moms are all united in that we want one thing. We want a better future for our children. We want opportunities for our children. We want them to have a future that they can look to with optimism and with hope. And yes, we want them to enjoy freedom. We want them to have the freedom to pursue their dreams, to fulfill their potential, and to make choices about the life and future that is best for them. But what's happening in Texas right now is one giant step backwards. The health and welfare of generations of Texas women, children, and families is at risk. Politicians like Ted Cruz, who have no medical training or expertise whatsoever, are interfering with how Texas physicians practice medicine. And ordinary Texans are suffering and are paying the consequences. Ted Cruz helped orchestrate the repeal of Roe v. Wade, and he knew exactly what would happen when the cherry-picked GOP appointed judges stripped women of autonomy over their health care and over their bodies and interfered with the sacred doctor-patient relationship. And we have experienced this since the Dobbs decision. Women and physicians across the US, and notably here in Texas, are living the tragic and dangerous consequences of Ted Cruz's actions. Doctors are afraid to provide reproductive care their patients need. We're witnessing that firsthand. Texas pediatricians now hesitate to perform the most basic medically necessary urine pregnancy tests in our office because then what? And now we're also witnessing the next generation of America's doctors, prospective medical interns and residents avoid coming to Texas for their medical training because of our abortion ban. Texas women and children cannot afford to have even fewer physicians in our state. Texas ranks 50th, the second worst in the nation for women's health outcomes, and 50th for access to high quality prenatal and maternal care. Texas has an atrociously high mortality rate, among the highest in the US. And Texas is 49th in overall child health, has the highest rate of uninsured children in the country, and ranks 47th on the child and adolescent immunization rate. And politicians like Ted Cruz are making those Texas healthcare statistics and outcomes even more dismal. Ted Cruz only cares about himself. He doesn't care about the fact that girls growing up in Texas right now have fewer freedoms and rights than their mothers did. He doesn't care that even more broadly, the consequences of his efforts to get Roe overturned and abortion banned won't just be felt in the medical field. They will be felt everywhere. What does it mean to tell our daughters and to tell our young patients that in the Texas they're growing up in, their home, they don't have the right to make decisions about their own bodies? For every young girl who becomes pregnant under traumatic, coerced circumstances, how can we as physicians explain that the politicians and judges with no medical training or expertise have decided that in Texas, those girls must carry that baby to term? Incest, rape, 13 and 14-year-old girls. And then what? We need leaders who believe in all Texans' freedom and who believe that Texas women, not judges or justices, not politicians like Ted Cruz, should be the ones deciding their own futures, and that expertly trained, experienced Texas physicians should have the freedom to provide the medical care our patients need and deserve. That's what's at stake in this election: the health and welfare of our generation and generation of Texans to come. Colin Allred understands that, but unfortunately, Ted Cruz only cares about himself.
Good afternoon. I'm Domla Carson. I'm an OBGYN here in Houston, Texas, and I'm actually raised here in Houston, grew up here, came back to practice after my training. I'm a general OBGYN, so I'm taking care of pregnant women, delivering babies, and living firsthand the impact of the abortion ban here in Texas. Some of you, all of you probably are familiar with the Kate Cox case. I'm also her physician, and I think her case illustrates how tragic these bans have been for women, for families. Oftentimes women who are trying to grow their families. And we found that maternal mortality is going up. We found that infant mortality is going up. These are all the result of the abortion ban that Ted Cruz was instrumental in putting in place through his actions over the last 12 years. He has been consistently anti-abortion, and now is trying to hide from the havoc that he has wreaked in the medical community and for women and families here in Texas, as it is now playing less favorably for him politically. So I think everybody needs to be aware of that. He is trying to change his tune a little bit, and I think everybody needs to be aware of the impact that this has had. There is so much fear and so much confusion in the medical community. You know, we are not attorneys. We read these laws, but are not always confident in our interpretation of the law. We rely on our legal colleagues to advise us, and even there's a lot of confusion, even at the hospital level, at the Texas State Board, Medical Board. I feel like there is no clarity. I guess that's the main thing I want to say, is that when is a woman's life at risk enough? When is she in danger enough of dying in order for it to be okay for her to have an abortion? The penalties are so steep with the abortion ban, as I'm sure you're all aware. 100 years, 99 years in prison, losing your medical license, your livelihood, and $100,000 fine. So there's a lot of fear, not just among physicians, but also among nurses, among hospital administrators. And this results in delay. Even if the patient is able to get the care she needs, there's a lot of confusion and many processes in place to try to figure out, does this meet the requirement? Does everybody agree? These sometimes are decisions that need to be made quickly, and there are bureaucratic and legislative hurdles that we need to overcome in order to be able to proceed with caring for our patients. There are patients who are, I'll give you a good example. I had a patient who was in the process of miscarrying, and everybody was worried about whether there was still a heartbeat while this patient is hemorrhaging. And so everybody's trying to figure out, are we going to allow this to happen? Can we help her complete this abortion, which is in process? She is losing this pregnancy. And yet the idea that there might be a heartbeat, that we might be somehow crossways with the Texas abortion ban, is putting these patients at risk. Miscarriages are very common. This is not unheard of in an ER setting, to have these patients come in bleeding, and now we're putting up barriers to care. Not to mention the examples that were brought up before of rape, incest, and then the whole idea of pregnancies that are non-viable. These cases are so unique and nuanced. They need to be managed in consultation with the patient, the family, the healthcare provider who has the knowledge and the training and the skill to advise them at the risks and benefits of the potential options that are available to them, or were available to them and are no longer available to them. It goes against the standards of care. It goes against the, I've taken to telling people that as physicians, we're in the business of trying to minimize risk. And this legislation is now asking us to let the risk get worse, let the risk get higher to these patients before we intervene. And it's just the antithesis of what we in healthcare are all about. We're about keeping our patients safe, mitigating the risks to their well-being, their lives, their health. And so I kind of got a little off script, I guess, because a lot of the points that I wanted to make were already made. But I think it's just important to emphasize that that Ted Cruz does not care about women, does not care about their health, their well-being, their freedom, their bodily autonomy, and Colin Aldred is very much in support of reproductive freedom and bodily autonomy, and that's why I'm here today.